Berries and Tea Monday show. We've had it a weekly ever since December. This is so impressive. And today we have a speaker, a plastic surgeon, a really good friend of mine, Dr. Shahram. So I'll just wait for him to join live and invite him to the show. There he is. Okay, I'm going to send you a request, Dr. Shahram. Let's see how I do this. Wait. Yeah. I invited you. Hi, Liberty.
Hello.
Hi. I love you so much, Shahram.
Thank you very much. The feeling is
You're
mutual.
amazing. Oh, it's so good to have you here.
Is the light all right?
It's perfect.
Very
You
good.
look handsome as ever.
Thank you very much. I did my best.
Okay, so before we start talking about this, I have to say a few things. A lot of people were surprised. Nigora, you're going to have a talk. Yeah, here's my team. You're going to have a talk with a plastic surgeon. Aren't you like against all of this and da-da-da-da? And I said, you know what? Shahram is very special. He's very different. And the amount of clients you referred to me because you see the difference between when they do need a little lift and tuck or when they see that something can be done naturally. So I'm very grateful to you for that and also being so honest with your clients. So that's one part of it. The second part, I don't want to be seem so, strict and anal in my views. You know, there's lots of options, and to be honest with you, there's there are people that will never look at our ways of lifting the face. They will always turn to something else, and it's good for them to know what is that all about. And then there are also people that will never turn to surgery or any of those, and they will always try to find other ways to keep themselves young. So there's always someone to accommodate to. But pardon?
Yeah, absolutely.
Yes. So before I let you talk, because this is, all about you, I guess give us a little like introduction into what do you think about face fitness as a plastic? Am I stealing all your clients, Dr. Shahram?
No, not at all. No. This is not the case. I mean, it's like building a building. It doesn't mean that if you are naturally you have to prepare the soil, prepare the land, do the basis of it, and then the building can be built on it. So we're actually not against each other in any ways at all, but rather our collaboration can help the patients or clients actually benefit from it, rather than we can help each other out. Obviously, it's very natural that if you can achieve something naturally and with your own will, it's much easier. But unfortunately, we're living in a era of instant coffee. We want something immediate and instant. We don't have patience for anything. We want systems to change instantly. We want our food to be ready instantly. We want to get in shape instantly. But that's not possible, just simply not possible. And when I operate, patients want to go through the whole process of getting well instantly. And I tell them that this is nature. Nature is very complex and it takes time.
Yeah, it takes time. So I want to tell you a story of one lady who had a nose surgery. But prior to the nose surgery, she did 6 or 8 weeks of work with me, facelift massage, the one that you've experienced on your face as well. And I didn't even know that she's going for nose surgery. I really didn't. And she did these weekly massages with me. I even recommended her which products to use for her face because her skin was so oily and so on. After the surgery, the surgeon was shocked at how she was without any bruises Can you believe that? Apparently this never happens. I mean, you would know better. She
It
was
happens
not
in my
without
hand, but usually it doesn't happen.
Oh, okay. But because her skin was, he said, was so oily and blah, 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 you know, so she would end up with lots of bruises and her recovery will be like up to a year. You know, it also depends on a surgeon, of course. You're one of the best.
No,
So
but
he
that's true.
was, that's true, yes. So he was shocked that there were no bruises and he told her that your recovery will be 3 months.
Yeah.
And she didn't tell him that she did all these face massages. And I said, good, don't, because I don't want 100 people on my massage table after that, prior to the, but I was just wondering how, wow, it's amazing how we laid that foundation, as you just said. We lay that foundation to make the skin work better, the cells work better. So then when the surgery did happen, it recovered so fast.
Absolutely. I have to plug this in just not to lose my battery, you know, just to be
Okay.
on the safe side. But yeah, you know, let's go to the basics of it really.
Yeah.
You know, what do you do with exercise? I mean, what does exercise in general, how does exercise help against not exercise at all? You know, the first thing that exercise does and massage does is to improve the blood circulation. When blood circulation is improved, obviously the healing process gets much quicker and easier. And sorry about this, but my battery is almost off as usual. So I'm going to try to see if I can fix this way. Did I go
That's
away?
okay. Don't worry.
Oh,
There's
no.
5 of us watching you.
Is it okay now?
So you have to,
Upside down?
yes.
Is there any way to make it straight? Maybe like this, perhaps. I will fix it, don't worry. Yeah, it's better now, not? If it just stands there.
Yeah.
I have to bring something
I love
else.
how 5 people are still watching us. It's good. You guys stay there.
Good. Yeah. So what I was trying to
Okay,
say
you were
is that,
saying.
you know, exercise, massage, apart from, you know, it does three major things. The first thing is that it promotes blood circulation in general. And if you do specific exercises, it promotes circulation, blood circulation, and lymphatic drainage with the help of massage in that particular area. But on top of that, exercise improves the production of all the goodies, the hormones, which give you the feeling of well-being. Now, the hormones by themselves not only make you feel better, but actually make you feel younger and make you younger. So exercise in this respect improves the whole well-being, but specifically regarding what you call it, operations. If you have a better blood supply, obviously, you know, at a better lymphatic drainage, obviously your downtime will be much shorter and you will reach your final destination much quicker. This happens with face, it happens with body, it happens with everything. But this needs a little bit of effort. You know, the problem is very simple. The problem is the matter of communication with me and my patients. And I always try to tell them that you have to start with basics. If you have an oily skin, if you have a dry skin, if you have, you know, this, that, do you drink enough water? I mean, you know, that's the very basic things. If you don't drink water,
Yeah.
you know, take as much vitamins as you want in your life, but it doesn't help. So there is a step towards well-being, and it starts, funny enough, with very basic things. On the contrary, why we tend not to operate people who are smokers? Not because we have anything against smoking, I mean, that's their life, but the point is that the microcirculation becomes very bad. On the other hand, the attachment of carbon dioxide to the hemoglobin, which carries the oxygen, is much actually stronger than oxygen. So once it's attached there, there is no space for oxygen. Without oxygen, there is no healing. So, you know, you fall into trouble. So, yeah, well-being, I think it's important. it's important from my perspective to optimize the patient in your capable hands to their best capability, and also, you know, psychologically improve their well-being. Because, you know, honestly, obviously, we all, for some reason, we want to be better looking or beautiful or whatever, or healthy. But funny enough, happiness, which is the ultimate goal of anything, doing face massage, doing exercise, doing surgery, does not depend that much, in my humble experience, to external appearance. It's something within. And if that happiness is there, then the positivity of the patient, you know, because the patient is is the product, you know. So we are just the tailors. The patient is the material. So if the material is in a better shape, well, obviously the result will be much better.
Yeah. So something about, you said, happiness and confidence. So I remember coming to your office once, and you had these fake silicone boobs, you know, all sorts of sizes. So, and I'm pretty flat-chested, you know, we all know that. And I put those in.
I don't know that, but good to know.
Yeah, I'm pretty flat-chested. So I put them in, right? Those, you know, I don't know what size it was, pretty big. And I look at myself in the mirror, and I'm like, wow. In a moment, I felt so confident, and so, because obviously back then, you know, it was like 5 years ago or 4 years ago when I went to your office, and I still had, you know, physical appearance issues. I don't anymore. I'm pretty happy with my flat chest. But then I felt a moment of, it really, really changes your sort of perception and energy. And you're like, I can do anything now, you know? So if happiness is the ultimate, and if it makes someone happy to do a nose job or to get breast plants, so, but which is great, you know, I don't want to say no to all of this, you know, if you're happy to do that, then please do it, because then the energy around it is different, right? But aren't there side effects from breast implants, Dr. Shahram?
Yes, there are side effects. I mean, you know, surgery is whenever somebody, you know, we're long trained to deliver a very safe approach, especially in aesthetic patients, because really they are not ill, you know, they are most of the time in better shape than I am. But the story is that with any surgery, there are risks. Any surgery is a trauma to the body, any surgery. Now, with breast implants, there are two major problems that can happen, and that can happen to anybody, irrelevant of who the surgeon is, what the technique is. One of them is capsular contracture, which means that whenever you put a foreign body in your body, then your body tries to isolate that foreign body from the rest of your body. So it forms a very fine film, which is natural. It happens with anything, which is all right, no problem at all. But sometimes, because of some reasons which we don't exactly know, but nowadays with the modern implants, it has become really minimal, but still present there. This capsule, what we call it, the capsule, becomes thickened, and it gradually, by time, contracts and deforms the implant which is inside it, right? So this is called capsular contracture. It's a well-known complication of breast implant. It doesn't happen to everybody. I think with the new implants, it's about 5% of people in long term which will go through that. And there is another serious problem, which is a lymphoma. So it's not a breast cancer, but it's a cancer of the lymphatic systems. It's extremely rare. With the new implants, it hasn't been seen yet, But we have changed the concept of implants about 3 years now, 4 years. So now we have a new era of implants. So far, it hasn't been present at all. In older implants, there is a very, very low percentage. I don't have it I don't want to say something which is not accurate, but very rare. Something about 1 in 3,000 people might get that. Treatment is not complicated, diagnosis is not complicated, but the implant has to be removed, has to be changed, the area has to be cleaned, the capsule has to be removed, whatever is around the implant, but it's curable. So these are the 2 major issues. Apart from that, there is no major problem with implants. So they're quite safe. There are more than 2-3 million people having implants in the world, so
So what you're saying that 3 years ago, the breast implant industry came up with a new product, a new implant that is even safer than what it was before.
Correct.
Wow, that's quite that's quite impressive that the industry.
It's not only safer, but it's more natural looking. It's amazing. The new implants are fabulous, and they're still working on it because they want to reduce the weight of it. So they're still working on it. There's a company in Israel that has come with a technology that has the mass density of it is low, like fat. So it'll be even lighter. So yeah, that at some point we will reach that as well. But so far, the new implants, I'm extremely, extremely happy with them. Patients are delighted. And there is another issue which you pointed out correctly. There are some things about femininity, and breasts has always been part of our femininity, nurturing capabilities, and it has a way more deeper root than just an attractive figure. So it goes very deep inside a woman's soul. So I always say the chances are there, the possibilities are there, and if I was a woman and if I had a flat chest, I would definitely do it. Do you know what I mean? Because then it gives you that confidence. I would definitely.
Well,
I had a patient who I operated the nose and the breasts together, and it turned out both very nice. And then after a while, I said, well, how is it like? How did people, react to your nose? I said, nobody realized. I said, how come? I said, because everybody's looking at my boobs, so it's funny.
So I have a question. There's a company in the world, I'm not going to say the name, that produced some oil which is like full of herbs. And what they claim is that with that oil, as you massage your breast, after 6 months, your breasts will grow. So obviously I got the oil because I am flat chested. And, I've been doing it not regularly because, lack of time, whatever. But do you believe that some oil full of Chinese herbs and some massage techniques on the breast 5 minutes a day will grow your breast double size, they say? And you see photos on their website.
I don't know really. I have reached the age that I cannot say, I cannot deny anything in this world is actually possible. It's a fabulous place. However, triggering the size of a breast is quite a complex process. You see, because when you are pregnant or when you're breastfeeding, or very much depends on your hormone state, even a person who has bigger breast or flatter chest or whatever, but you see that within your cycle, there are differences in the shape and size of your breast. So if it is not, because, hormones are very, they act very precisely. A little bit of more hormone, a little bit of less hormone makes a person completely off balance, and it might have side effects somewhere else. So my answer is I really don't know. I don't know whether that would be possible or not. But you know, we have to look into it. Just continue
But
massaging, and we'll see. You know. But
but it
as a plastic surgeon, sorry, Nigora, but as a plastic surgeon, what I like to offer is something which is stable relatively, is reproducible, and has low danger. So this is what I would like to give. So whatever treatments we offer to our patients, they have been studied, they have, licenses. So it's not like, somebody comes up with something and we just apply it. It has really serious regulations behind it.
got it.
And we are seriously regulated as well. We have to go through exams, we have to go through licensing, we have to produce our logbooks. So we are licensed, the product is licensed. So more or less, a person would be in good hands.
Well, if I ever considered a boob job, I would only come to you, of course.
Thank you very much. That's very kind.
But I don't know if, I don't know if I would, because for me, it's not even, I just don't like to traumatize my body.
I understand that. So, I mean, it's something, but the benefits of it is, it's really immense. I remember once in my life that I had a very, very, because you have smaller boobs, flatter chest, bigger boobs, saggy boobs, there's, you name it, I had once, I remember a lady, and I was working in the university, so a lady came to me, and she was not, she was 28 years old, didn't have any serious relationship ever with any boy, because she was very concerned and very shy. When I asked her, okay, I have to see, then she started crying. And eventually she showed me, I took pictures, and I studied my pictures at home. After a while, when I downloaded my pictures and I was studying my pictures, and I thought to myself that, why did I take this picture from this guy? I mean, what is the problem? I couldn't remember. Then I remembered that this was that lady. I told her that at that time, I was a poor, assistant, like a lecturer in the university. So I told her that I will help you with your insurance, because that was in Europe. She had it had psychological and social impacts on her. So the insurance actually, and the area was so tight, the skin and muscles were so tight that there was no space to put an implant. So we had to first put an expander, expand the tissues, and then take the expander out and put the implant. So, and that's obviously more expensive than a regular implant. But I told her that even if I have to sell my car, I will sell my car and help you. Fortunately, the insurance helped her, and she got really, really beautiful boobs, and that little devil started to come out of her.
So she got a boyfriend, got married, and has kids. Yes. Happy end?
Yes.
And it's interesting, and I love how we can look at this from different perspectives. Because for me, I'm like, okay, you don't have boobs, they're very small, but then there's other beauty in you. You can radiate with confidence because beauty. If we define beauty by like market standards, which is like small nose, big eyes, big boobs, like long hair, slim body, then all of us are pretty mismatching, that standard. And we're always trying to meet that standard with the surgeries or the enhancers or whatever.
100%.
Right? But why don't we define our own word beauty? So I, Nigora, can define my own word beauty, and someone else can define their own word beauty. Like, I've got quite a nice, big sized nose that I have accepted. I have very small boobs. I've got beautiful long hair, and that for me is beauty. Like, I've got my definition of beauty, and more alongside that physical appearance, and then someone else can define their own. So could she have could she have just seen herself beautiful as she is? And that's a question in my mind, you know. It's not that I'm judging her, absolutely not. I'm just wondering, you know, she took that path of, you know, enhancing her beauty and sort of using that intervention to help her. But then I think you guys, there is a reason for why you exist. God did create plastic surgeons on this planet.
We're quite good
To help
friends.
you. Pardon?
We're quite good friends with God, you know, because we're both in the business of creation, you know. So we're in a way colleagues, you know.
Yes, yeah. Yeah, no, I see that. So okay, fine. Let's go away from the topic of boobs, and I want to know this other thing that you do, Shahram. I once came to your seminar, your workshop, and you discussed this procedure where you take fat out of the body, let's say out of the buttocks, just a little, and you inject it into the lower part of the eye, right? To create more, or any place on the face.
Yeah. So you see what happens, let me give you a very short introduction, is that this is called lipofilling or fat grafting. You know, there are two issues we want to achieve, and both of them are in vain. And I'm a plastic surgeon, I'm telling you. Because actually, if you philosophically look into it, I doubted that this world is our final destination. Honestly, I don't believe that. So I think that this is just a path. For some reason, we're here to experience some things. I don't know why. But then eventually we will surpass this life. Whether it will be darkness, whether it will be nothing, whether it will be, you know, something else, I don't know. Nobody knows. But I don't feel that this is our final destination. But this becomes a little bit philosophical. During this destination, we start from a point and we end up in a point, right? And fortunately, if we're fortunate enough, that end point is in our elderly ages, right? We don't die from a heart attack or an accident, or God forbid something else, war or whatever, during the course. And obviously, we age, right? We are bound to this planet, which has a very, very strong force of gravity. Gravity is the force that we underestimate because it's like oxygen. You know, we have oxygen, we breathe oxygen, but the moment our head goes under the water, that's the time we realize that, you know, something is missing. Gravity is the same thing. I mean, if it wasn't gravity, you know, I would be stuck on the ceiling, you would be stuck onto your ceiling, and we're trying to turn the mobile on to communicate. So it won't be compatible with life. This is what we have. So we have the forces of gravity. We have the forces of aging. Now, aging is a very interesting thing because, you know, one would think, you know, that it's just the effect of gravity that causes the aging. You know what I mean? But that is not the case. If you would be living in the moon, you would age as well. That's a cellular level. We are programmed to age. Now, the shape of aging, because of the effect of gravity, naturally is different probably than if we were living on Saturn. But on Earth, this is the way we age. 7.8 billion people, different ethnicities, male, female, transgenders, you name it. And the trend of aging is pretty much similar, but there are differences among races, among shapes, among faces. One of the things, and I want to reach this point, one of the things that happens in aging is that the fat is redistributed. So the amount of, you know, we used to do facelifts, whoever walked into our offices and had a little bit of sagginess here and there, we just went down and did an effect against what had gravity done to that face. But then we realized that, okay, I mean, the face looks better, but doesn't look like her. And she was younger. So what is missing? So we started studying and we realized that it has many dimensions, this aging. One of them is, yes, the effect of gravity and sagginess, which happens on boobs, on testicles, on cheeks, on you name it. But one other problem is that we actually, by definition, we lose mass, you know. Part of this loss of mass is muscle, part of it is water, and part of it is fat. So now we have products to sort of replenish the water in a way. We're getting there. But one of the things that we're missing or changes or redistributes itself is fat. So fat, as we age, goes away from our face to other places. In men, typically the tummy, and the females on their bums, right? Now, parallel to this natural aging, you also have very fit people like yourself, okay? Now you do exercises, face exercise, and you try to keep your volume. And trust me, you need volume for the face. The amount, the structures without volume will look very tired, right? So what we do with lipofilling is that we take a little bit of fat, typically for the face, the lower part of your thigh. We prepare it. We make the granules of fat pretty similar, like a minced meat, but with certain amount of viability of cells. And then we very gently separate the water and blood and whatever from it. So we get more or less a pure fat, and we can inject everywhere on the face. Everywhere. So basically nowadays, I don't say never, but usually I don't do facelifts without fat grafting. And the beauty of fat grafting is that it doesn't involve any scar, just very two little scars where we get the fat. Sometimes if a person is strong enough or calm enough, we can do it in a under local anesthesia in the office. I often do it, and it's completely natural. You know, you don't get any foreign body, and we use the fat from the inner thighs because that fat is actually the fat that doesn't undergo too much changes. Because when you transplant the fat, that fat is still not your face fat. By molecular level, thinks that it's in the thigh. So if you take it from, for example, for a face of a man from the tummy, and the guy gains weight, so that this fat will grow as well. So we want a stable, more or less stable fat, more or less the same color. We can inject this fat to the forehead, to the temples, on the upper eyelids, lower eyelids, cheeks, face, and chin, and try to make a person look voluminized a little bit. So replenish that volume that has been lost. When I say this to patients, many of the patients get terrified, and they mention names of actresses and actors, and in the street, people who they know, that they look like balloons. Yeah, I mean, like anything else, you can enjoy a cup of tea, but you can also drown in a cup of tea, in an immense amount of tea, right? So it just depends on, you don't necessarily, it's not an all or nothing law that you have to make definitely a person look like a balloon. So yeah, so this is really, really interesting. It's one of my favorite topics.
I think, Shahram, I really think it's fascinating what the science technology has brought us to, to take fat from the inner thigh, to separate it, to really take the pure fat and be able to inject it into the face. I think it's mind-blowing, really, that that growth, that expansion in ways that, I mean, what, 20 years ago, maybe less, 10 years ago, this was not thought of, right?
Very funny enough, this is quite an old thing that surgeons did many, many years ago. Then they left it aside and they used it again, refined it. But now we are at the stage that we can say that about 80% of the fat that we inject is viable. So we have a technique how to treat this very gently, so the fat will be actually viable for injection. And we get amazing results. Now, the funny thing next to it is that we try to help the volume with this fat, but what we see as a side effect is that the quality of the skin has improved, the quality of the muscles has improved. So, because the fat cells also contain a certain amount of stem cells, which can actually act in correcting the injuries that has happened, wear and tear of the face and skin. So it's amazing, yeah. And and also we can isolate. I mean, there are labs. We're lucky enough in UAE to have one of the 5 labs in the world that can actually technically isolate stem cells for us. It's an expensive business, but like anything extravagant, it's it's expensive.
So let's put it this way. If I do my facial exercises, which I do religiously, I can work my cheekbones, my forehead is pretty flat, like I don't have any lines, any very, very fine lines. But I'm only 32 years old, right? So by the time I get to 40, can you envision what will happen to my face?
I can.
Tell me. I'm ready.
I can. I mean, it would be I mean, if you continue your lifestyle, and I have been honored enough to know you from 7-8 years back, and I can see the changes, and we have a little bit of a trend of how things are happening. You look top of your game now. There is no question about it. But there are changes, and you can use even softwares. There are softwares that show you, every 5 years, 10 years, how you age naturally because of your exercises. The aging process will obviously not stop because that's in a molecular level, but it would be a much more pleasant sort of aging. You see, we have lots and lots of muscles in our face for facial expression. Many of these muscles actually we inherited from monkeys or dogs, but we actually don't need to use them. Frowning, for example, it's a facial expression that we can do without. First of all, we don't need to frown. Second of all, in some mammals, they use frowning because they cannot converge their eyes. Our eyes can converge and diverge, but in dogs they can't converge. So they reduce their sight, so the beams of light go straighter, so they can look in a little bit of a more distance way. But we can converge, we can diverge, we can do lots of things. So we really don't need frowning. So there are muscles like that. On the other hand, there are lots of muscles that we don't use and we should use, like our cheek muscles, our laughter muscles, our orbicularis around the eyes. You see, as we age, the bags under the eyes are visible. This line becomes deepened. This line becomes deepened because this part, we lose fat. And the second issue is that because we don't use these muscles, this tends to come down. So this line becomes visible. On top of this line, we don't use our orbicularis. Sometimes you have to just do this for these orbicularis muscles, which is the sphincter around the eyes, to contract, to be tightened, so pushes the fat inside. If you don't do that, then the fat, starts to come out. And again, I mentioned.
Sorry, Shahram, I have facial exercises for that, for those muscles around the eyes, okay, for the lower part of the eye, for the cheekbones. That's incredible, yeah.
So it's very important, and on the other hand, a muscle to be optimally functional, you need to exercise it. The size becomes bigger, like our arm and triceps and biceps and pectoralis. And abdomens, the muscles of the face are the same. They're very fine muscles, but they are very well, you can exercise them. And you can increase their volume and strength. Again, let me mention cigarette smokers. I'm sure you've realized that the lines of the cigarette smokers on the skin is more prominent. The neck is more prominent. These lines are more prominent. The reason for that is two things. First is that they are dehydrated, right? The reason they're dehydrated is because centrally their desire for water, because of nicotine in their brain, becomes less. So they don't need that water. Second of all is that for a muscle to work properly, it needs oxygen. So there is less oxygen available. And obviously body is clever, you know. We'll say, okay, we have this amount of oxygen. Let's put this oxygen aside for the heart, for the kidneys, for the liver, you know, the hair. It's not that much of an importance for life, you know, if you have hair or you don't have hair. If you have, you know, baggy eyes or you don't have baggy eyes, you know, as long as your kidneys are functioning, you're fine.
That is so interesting.
I'm just kidding.
Pardon? Where's your cigarette?
I said, where is my cigarette?
Yeah, it's a shame, you know, every time I see smokers and they do the facial exercises with me, and I sort of say, you know, first, just really question why and how can you decrease or remove smoking.
But it's still better than doing exercises than not doing exercises.
Than nothing. Yeah, you're right.
You know, the problem is, I think, regarding smokers. Now, I don't have anything against smokers or towards smokers, but the problem is that we always criticize smokers, not me, the system, criticize smokers and threatens them with dangers. You know, you buy a pack of cigarettes, it says that, you know, you will die from cancer, or, you know, you will lose your capability to have kids. But there is no system that would give them the benefits of not smoking, you know? What are the benefits? What would you get? You know, you quit this, it's difficult, but what are the things, the benefits that you get, you know? I think that's very important.
That is so true.
And they get lots of, so if any smoker is listening to me, as a doctor, I say that try, if you can, not smoke. There is a, you know, there's immense amount of benefit of not smoking. You just have to not smoke for 120 days, and then you will realize that as if your body has rebooted itself. By itself, it's amazing.
I really hope we have some smokers listening to this now or later. Anyway, I think, Shahram, what a wonderful conversation you and I just had. Like, we really dissected so many things, quite literally dissected, especially the boobs, the topic on the boobs, and you know, and how face fitness is actually so complementary to anyone who considers a plastic surgery or even after plastic surgery. Would you say?
Absolutely. I mean, lymphatic drainage is immensely important, you know, because the circulation, we cut some circulation from some areas when we do, for example, a facelift, and this has to get its circulation from a different area which is not used to it. So, you know, massage and lymphatic drainage and exercise will have benefits after a certain time, obviously.
And yeah, of course, it takes time, it takes discipline, at least 3-4 months of daily exercises, and then only can you see the true benefit. And I always say that the key behind facial exercises is blood circulation. That's it. We're enhancing the blood flow to the cells of the skin so they get better oxygen, they get better nutrition, so they work better, they're more glowing, they radiate, so you don't really have breakouts as much. You don't really have blackheads as much because the skin works on its own. It starts cleansing itself because it's just rejuvenated all the time with this fresh blood, right? And then with the massage techniques, whether it's a gua sha, whether that's hands, whether that's vacuum cupping, that's the lymphatic system that you talk about. You know, we're constantly draining it and enhancing it and strengthening it. So really, that's why these are powerful tools, but these are not an overnight like magic trick.
Yeah, of course. Exercise is not overnight. And, you know, to be honest with you, operations also for reaching your final outcome is really not an overnight thing. You know, nature is complex. Healing is a very complex process. It's a miracle by itself, you know. You really don't need Moses to come and put a stick in the water and divide it to see that's a miracle. If a hand is cut and you just put it together and it heals by itself. And good news is that recently I received I've been waiting for this for many, many years. There has been some research that has shown, with the help of a medicine, that at this stage in Stanford University, at this stage they have been able to use this medicine, that after a surgical cut, when you put back the skin, there will be no scars. That's amazing.
No scar.
No scars. So, you know, whenever we are born, since we are born and we cut our skin, put it back together, it heals beautifully, fantastically, miraculously. But there is a scar. It might be a very nice scar, but still there is a mark. So, you know, I think that if this works out, this is definitely a Nobel Prize.
Wow. I have a scar right here.
There you go.
On my forehead.
So you just wait a little bit and then I will cut it out, apply this medicine, put it back, and there will be no scars.
Okay. I'll wait.
One other thing I want to tell you, and this is also, you know, philosophical a little bit. If you see a smiling face, a laughter, full of joy, you'll see that all the facial muscles are pulling upwards.
Yeah.
Right? On the contrary, if you see a sad face, everything is pulling downwards towards gravity, right? So these are interconnected. When you have a happier face, you would feel better. If you feel better, you apply that happiness on your face. So I think that one of the best exercises for face, and correct me if I'm wrong, is just laugh. Enjoy it. Enjoy the ride, as they say.
And you know, Shahram, this is not just true from an energetic and philosophical perspective. There's also a yoga called laughter yoga. And people, I know a friend of mine did a course in laughter yoga to teach it. And she said that the people that attended, you know, they were like 80, 90-year-old people that their face was like completely smooth because they laughed 5 minutes, like as an exercise every day. You know, and they have different exercises, they laugh, they teach laughter, they're just happier people. So I think this is such a good point that maybe I should also introduce into our, you know, natural techniques of anti-aging is introducing that 1 minute of laughter.
Tickle yoga.
Tickle yoga. Yes. Tickle yoga. That, you know, that's a very good point that you raised that I completely actually forgot about, because I'm a little bit conscious about my lines around my eyes that I get because I'm smiling and laughing all the time, you know, and I've got these really fine lines, which as I age, they'll be very deep. But I
it's
just
right.
sort of...
You know, the funny thing is, Nigora, those are very easily treated by us, so don't worry about that. However, the benefit, you know, outweighs those little lines.
Yes.
And also the other issue is that, funny enough, if you see a face, man and woman, now here I have to tell you that for some odd reason, I think nature has been a little bit softer and a little bit forgiving for men compared to women. Yeah. Women have a more difficult nature. But if you see a face with few laughter lines, still that's a pleasant face. Has lines, but it's a pleasant face. But if you see these lines here, it's always, you know, always you get scared, you get a little bit distant from that person. So I always say that If you have lines here, try to laugh more, try not to frown, wear sunglasses, come to us, you know, and we will help you. Because even my little daughter sometimes comes and tells me, Daddy, this is very deep, you know. So it is a very natural sort of a reaction of a human being when you see that specific lines. So laughter lines, yeah, I mean, you know, everybody, you know, we age, you know, there's not a, as I told you, there is no way around it. So it's better if we age in a pleasant way rather than in a sad way.
Yeah.
So keep laughing.
Okay. I will. And then when I turn 40 or 45, you'll fix my lines.
Yeah, by that time I have to tell you that I'm planning to retire.
Okay, fine.
You're in good hands.
Okay. Oh, Shahram, this has been such a wonderful conversation, and I would love to have you back on in a month or two, where we can talk about maybe some other progresses of the plastic surgery industry, which is I find really fascinating, and I really applaud the science for growing constantly. It's really quite incredible.
Yeah.
I hope you also enjoyed yourself, and I want you to give our audience just 3 tips on life.
First of all, let me thank you for this opportunity. It has been really a delight to chat with you anytime, in any circumstances. You're a very positive person. So my 3 advice is laugh, take it easy, and enjoy yourself. Enjoy the ride, because it's more or less a short ride.
Yes. It is a short ride, you're right. So here we go, ladies and gentlemen. This is Shahram for you. I hope you enjoyed yourself listening to this amazing human being. We learned so much. I really learned so much, and we will love to have you with us again sometime soon. And please, guys, follow Dr. Shahram. Any questions or on anything a little bit more advanced than what I offer, then you go to Shahram, and he can definitely help you out in the most sincere, in the most truthful way. He will not just put you on a surgical table just because, you know, and I have so much trust with you on that, because I've seen, I've experienced. Pardon?
Thank you very much,
yes.
Nigora. It has been always a pleasure. Thank you very much. Thanks for the opportunity.
Thank you.
And bye.
Thank you all for listening. Goodbye, everybody. Bye.
Bye. Bye.